This week on The Wheelhouse, the lawmakers react. With lawmaking done for now, how's everyone feeling about Connecticut's future? For Connecticut Public, I'm Frankie Graziano. This is The Wheelhouse. It's the show that connects politics to the people. We got your weekly dose of politics in Connecticut and beyond right here. Last week on The Wheelhouse, we talked to you on the last day of the 2025 legislative session in Connecticut. We told you about a $55.8 billion budget deal, priorities laid out in it, including increased dollars for early childhood care. This week, we're going to hear from lawmakers on where the state stands going into summer 25. And let's welcome some of the lead dogs at the state capitol into Ollie the Octopus's lair here on Asylum Avenue in Hartford, a few blocks away. Joining me first, Jason Rojas, a Democrat, is the majority leader of the Connecticut House of Representatives. Good morning, Rep. Rojas.
Good morning.
Thanks for coming in.
Good. Thanks for having me on.
Appreciate having you. Folks, if you want to ask us a question, you want to get on really quick, give us a call, 888-720-9677, 888-720-9677. I'd like to ask you the first question here. Leaders from your chamber and the state Senate ultimately agreed on a $55.8 budget deal with the governor. Right. Some top line items we've heard about. Obviously, you found some money for Medicaid. Right. Earlier in the year. You sort of tried to fix the underfunded Medicaid issue.
Right.
And we also talked about a path to save some families money on child care. Can you take us into the negotiating room? Help us understand what some non-starters were for you, or at least something that you and Matt Ritter, the Speaker of the House, really wanted to get done.
Yeah, really. It was really a question of how we're going to fund it, understanding that we have these fiscal guardrails in place, which have really set some strict parameters about how we budget, how much revenue we allow ourselves to use. And the governor has been very strong and consistent in terms of his perspective on maintaining those guardrails. Certainly our Republican colleagues too, and quite frankly, Democrats have too, right? We have all abided by the fiscal guardrails that were adopted on a bipartisan basis in 2017. What we've seen over the last 5 years is exponential growth in certain types of revenues, of the volatile revenue. That was actually what caused us to actually put these fiscal guardrails in place. We realized that there are years, because of our proximity to Wall Street, we get a lot of extra money in one year. When Wall Street's not doing well, we lose that money, and we were budgeting in that way. So we ended up with deficits. And what we were trying to do is avoid those types of things. So we limited ourselves in terms of what revenue we could use. We decided to use some of that excess revenue to make a significant investment in early childhood. What we're doing is creating an endowment and putting up to $300 million in that endowment. We expect it to grow every year. And what we're going to do is use those proceeds to really invest in our child care providers, invest in families, and ensure that children have a safe and high-quality early childhood experience, because we know that is the beginning of their educational career. And if we want to see a good outcome at 18 and 19 and 21 years old, we really have to invest in kids when they're 2, 3, 4, and 5.
The fiscal guardrails, we're talking about the future. We're talking about long-term debt obligations.
Right.
And it's really worked for Connecticut in the regard that you all have a much better credit rating.
Yeah.
In recent years. The credit rating has been upgraded. And many people are happy with the finances and getting in all those surplus dollars. Right. So there's been arguments the last few years between lawmakers and the government and the governor over how to break through the fiscal guardrails. So how'd you make that breakthrough? What do you think was the tipping point?
Yeah, I mean, I think it's a recognition as much as people really want to see Connecticut be financially stable. We all want that too. There's also, we hear from our constituents that they'd like to see us make investments, and they keep hearing about these significant surpluses, $1 billion, $2 billion. Right now we have a $4 billion rainy day fund. Even after the budget we just adopted, we're going to see a $1.9 billion surplus that's going to go towards paying down those long-term debts. But there's also other long-term debts that we have, right? And it's an obligation that we have to families, an obligation that we have to children. And when you talk about those two things, you're really talking about the future of the state of Connecticut. So we need to be more balanced in terms of making investments to pay down those long-term liabilities that we did accrue over a period of 100 years. But for the next 100 years, we also have to make a significant investment in families and kids.
Other costs that are hurting Connecticut residents, and you hear this a lot, housing and energy costs. Right. I'm going to kind of focus in first on affordable housing initiatives. Right. you're getting criticized for overstepping local control. That's the complaint that people are lobbying against you.
Sure.
So how would you respond to that?
Yeah, I understand it. Right, housing policy and decisions around local control. It's Connecticut, right? Those are things we really value. I value them too. But I would question people and say, to what end? Right? Because we do have some of the most expensive housing in Connecticut. We have one of the most constrained marketplaces. You can't find a house to buy. You can't find an apartment to rent. And we know from an economics perspective, when you have less of something and there's more demand for it, the cost of it is going to go up. So what I'm trying to do is strike a balance between the state's obligation and the state's responsibility to set the parameters around zoning, which is our authority. We have that authority now in 8-2. I don't want to get too technical, but that is the area of statute that actually allows towns and cities to do planning and zoning. But obviously these decisions should be made primarily be made at the local level. So what we're doing is setting the parameters for how zoning should look, but we're relying on our partners in towns and cities to make those decisions. And yes, we're making some changes around that. Yes, that's a difficult thing for people to want to accept. But the status quo right now is local control, and the status quo right now is really expensive housing.
And you're talking about a status quo. You want to talk about a breakthrough as well. This is something you've struggled mightily in recent years of trying to. Yeah. I've seen you at the end of the sessions have to bemoan not being able to get housing legislation.
I didn't use painfully incremental this year. I used it for the last 4 years when they asked me, and this year I did not use it.
So one side might complain that you're overstepping local control. Another side might say that you all aren't doing enough.
That's right.
And how can you tell us this might bring about meaningful change for the people that are thinking that you're not doing enough?
Absolutely, right. And I appreciate that. I think people want us to be far more aggressive, right? There were people who were suggesting there should be rent caps. There was the just cause eviction bill that didn't pass again this year. There were a lot of people who felt that was really important for them. And what we're trying to do, like we always have to do, is kind of find a middle ground, right? And obviously the housing bill that we have out there, I think, is more aggressive than we've had in past years, really going to result in structural change in terms of decision making and how we think about certain things that we take for granted, like parking, like utilization of commercial spaces. And we know that the commercial marketplace is sort of collapsing and those properties are dropping in value. And you know what happens when that happens? You're going to pay more on your residential property taxes, right? So how do we put that land back into best productive use, and how do we address the housing shortage? Well, you allow commercial zones to be used for housing, for small-scale housing, not massive apartment buildings, right? But up to 9 units of housing on a piece of property. That's a better use of that property that's going to generate tax
So
revenue.
go there again, because I'm asking you to quantify this so that in an effort not to kind of mess around with you here, but we want to hold you accountable in the future on this. So help us understand how many units this could bring about. Do you have that understanding yet?
No.
Or what a goal or aim might be?
No, I mean, we had a needs assessment that was done that arrived at this 100,000 unit number, right? That 100,000 unit number, believe it or not, is just for individuals who are making 0 to 30% of area median income or 0 to 50%, folks at the lowest end of the income spectrum for whom the private housing marketplace is not going to develop housing for them. What do we do for those people? So that was the goal and number that was set out there that we're asking towns to plan for. We're not requiring them to build anything. Towns can't control all of those things, right? But they should set the environment for housing to be developed. And they already have to do affordable housing plans. We're asking them to use the data that was produced out of this assessment to inform their thinking about how they produce housing and how we produce housing across the state of Connecticut and how we produce affordable housing in towns and cities across the state of Connecticut. Because right now, it's really hyper-concentrated in your large urban areas, and that has the effect of concentrating poverty. And it has all sorts of ramifications, not only for the people who live there, but for everybody else. Because when you concentrate poverty like that, all of us have to pay a whole lot more money to remediate what comes out of concentrated poverty.
And if you're talking about incremental change, it might not necessarily be a bad thing in the regard that you've had those surveys out and you've been trying to hold municipalities to them for years.
Right.
And, or at least in the recent years, that was kind of like what you did get through in the last few years.
Yeah.
And now you're starting to see reap the fruits of that, it sounds like.
Yeah.
In terms of trying to turn some of that into legislation as you've tried to do this year. I want to go to energy really quickly. Yeah. This bipartisan push that ended up in the House, but I believe it started in the Senate, and there's a bunch of state reps on it as well.
Yep.
Tell us about this effort to, I guess, try to make those energy bills go down a bit.
Yeah, one of the hardest, maybe harder than housing is energy policy, right? Because again, there are only so many things that we can control. Unless Connecticut is going to get back into the business of actually producing more energy, more power plants, right? every time I'm in a public setting, I ask the room, would anybody like a power plant in their community raise your hand? Nobody raises their hand, right? More natural gas supplies, right? We have the environmental community that doesn't want to see that because they want to just move to more clean energy. So we have to import all of the primary resource to generate energy. And we're at the end of the pipeline in that regard. So it makes it really expensive to produce energy. So a lot of attention was paid to the public benefits charge that supports a lot of our clean energy initiatives. It supports our low income people who are struggling with paying their bills. It pays for those things. A lot of attention was paid to that last year when some things spiked. Primarily due to the Millstone nuclear power plant deal from 2017, but also it was a really hot July and people cranked their air conditioners and wondered why their power bill went up so high. Well, when you use energy and we're in a place where it's expensive to provide energy, you result with people who are really unhappy with their power bill.
We talked about this being a bipartisan bill. Let's hear from a person on the other side of the aisle, a state senator, Ryan Fazio out of Greenwich.
Yeah.
It's an issue that has been a top priority for me and other Republicans the past 2.5 years. We've been shouting from the rooftops that electric rates are too high and the public benefits costs need to be cut.
Essentially, what you all are doing here is trying to, I think it's finding state bonding money and trying to help people pay for the public benefits charge.
Right. So at the end of the day, the taxpayer is going to end up paying the bill. You either pay it through your electric bill or you're going to pay it through a tax bill. Because what we did do is we did authorize bonding to help cover some of those other programs that are right now funded by the public benefits charge. So you'll see a reduction on your electric bill in that regard, and that's a good thing. And then, it is smarter policy for the state of Connecticut to borrow money to pay for things as opposed to having Eversource borrow money because they're going to have to go out and pay 9 or 10% interest, where the state of Connecticut's going to pay 3%. So from a fiscal perspective, it certainly makes a lot more sense for us to do that. And that's what we did. We authorized bonding to pay for some of those programs that are really important to people. They may not realize that. They may not understand the benefits that they derive from that. But as policymakers, we have a responsibility to respond to concerns about higher energy costs, but we also have a responsibility to maintain a lot of programs that a lot of people rely on, even if they don't realize they really benefit from it.
We only have about a few minutes left with Jason Rojas here, who is a leader in the State House. 888-720-9677, 888-720-9677. If you'd like to join us on the Wheelhouse this morning, I want to talk to you about what you didn't get done, or at least, I guess there's two things. Maybe there's something that you're going to bring back next year in the next session, or something that you'll have to do either later in the summer or early in the fall. It sounds like that both you and Speaker Ritter have said that there will have to be a special session at some point.
Yeah, it's right. What happens in Washington, and they're going through their budget deliberations, and I don't know if it's as bad as we thought it was going to be in February, but it's still not going to be good. And there's still a lot of uncertainty. Obviously, the House in Washington has passed a budget. The Senate is responding pretty coolly to that, given how much it's going to drive up deficits, given that it's going to make reductions to Medicaid, which is really going to impact people and people. Everyone who's listening to your show probably knows somebody who's on Medicaid. And if they lose that Medicaid coverage, right, they're not going to be able to get access to health care. And if they do, they're going to end up in an emergency room. And if they do, you and I, through our healthcare premiums, are going to pick up that cost anyway. So it's much better to be proactive and provide people access to healthcare as opposed to not, when they're going to end up in an emergency rule and we all end up paying for it anyway.
I kind of lobbed this question, a similar kind of question, at Bob Duff, who is the Senate Majority Leader. He's in the other chamber. Yep. Let's hear what the Democrat had to say.
Connecticut's making great investments right now in education, healthcare, really in so many different areas. We are doing the exact opposite of what is happening right now in Washington, D.C. We have a balanced budget. They're racking up debt. So I think our budget is a responsible budget compared to what's happening in Washington, D.C., which is an absolute train wreck.
We talked about Washington, D.C. and having to sort of read and react. I'm always thinking about the football analogies. And we also talked about, you had said earlier that things may not have been as bad as you thought they might have been earlier in the year. But the point is, you've had to come up with a lot of Medicaid dollars that you probably didn't plan for. You have the shortfall, but then there's the ultimate reduction that's coming. So give us sort of an idea of what you might have to do in a special session in terms of, is it dollars for Medicaid? Is it more dollars for healthcare overall? what might be a push that you try to?
Yeah, I mean, we know that built into this budget that we adopted, that there's going to be a surplus, right? And we know that we have a healthy rainy day fund for situations just like this, right? Whether either there's an economic downturn and revenues have dropped significantly, we now have a rainy day fund to help backfill that. Washington acts in a certain way, makes reductions to Medicaid. We now have a savings account that we can go back to, draw from, to ensure that people can continue to have access to health care. Now, is that sustainable forever? Probably not. So we'll have to have some difficult conversations. And the options that we will have is reducing access, right? Limiting who can get access to Medicaid. And when you're talking about Medicaid, you're talking about folks at the lowest end of the income spectrum. You're talking about elderly people in nursing homes. You're talking about elderly people who are receiving care at home. You're talking about children who don't have access to health care. That's who we're talking about when we talk about Medicaid. And that's almost 1 million people here in the state of Connecticut who are in that program. And again, we can either be proactive and strategic and pay for it up front or pay for it on the back end. And I don't think that's a very wise policy at all.
We'll be awaiting news out of Washington, D.C. on the Trump domestic policy agenda and how Jason Rojas will react. He's a Democrat, the majority leader of the Connecticut House of Representatives. Thank you so much for coming here in person. I appreciate it.
Absolutely. Thank you. I'm sorry for not getting as dressed up and
it's
as nice
okay.
as you look.
This is this is a summer look, and you're very summery
Yeah, this
as
is
well.
my look at I work in higher education, and it's summertime. So.
It's time to enjoy the summer as well. We could do a
Absolutely.
little bit of work and look good as well. You heard from a ranking Democrat following the close of the 2025 legislative session for Connecticut Public. I'm Frankie Graziano. After the break, we're joined by House Republican leader Vincent Candelora. What would you like to see lawmakers prioritize here in Connecticut? Is the state doing enough to respond to changes in Washington? What issues are hitting your pocketbook this year? Give us a call, 888-720-9677, 888-720-9677. See you after the break. This is The Wheelhouse from Connecticut Public Radio. I'm Frankie Graziano. Connecticut lawmakers passed the 2-year $55.8 billion budget during the final days of the legislative session. That adjourned last Wednesday. The budget passed following agreement between Democratic leadership and Governor Ned Lamont. But many state Republican lawmakers say the budget upends the state's spending cap and will lead to future tax increases. Vincent Candelora is the leading Republican in the Connecticut House of Representatives. Thank you so much for coming in the studio today.
Thanks for having me.
I appreciate you coming in here. Folks, we got Representative Candelora in the House. We're hoping that you'll ask him a question, 888-720-9677. Maybe there's a point of a clarification on a bill or something like that. Give us a call, 888-720-9677. The way the session shook out, Governor ended up making a deal with Democrats that you say eviscerates the state fiscal guardrails, those spending rules enacted a few years back to drive the state's budget deficit, drive down the state's budget deficit. I think the 2-year plan adds about $1.2 billion in spending the first year and then $1.4 in the second. My impression of the situation, I'll have you react to all this in a second to what I'm saying right now, but I just want to get my impression out to see if I'm right or I'm leading folks in the right direction. Generally, you and the governor are almost not necessarily in lockstep, but you guys are in a similar position when it comes to the guardrails. It seemed like either you didn't have the input this year or you just weren't on the same page with the governor in that regard. Do I have it right?
Yeah, the governor really put the football in a different spot in the field when he started the budget negotiations. He came out of the gate back in January saying that he was willing to adjust the volatility cap. That was sort of a non-starter for us. Part of the reason is that we were entering this budget cycle with a $500 million deficit. We have overruns, in particular, of Medicaid spending, which drove us there. We ended up having to use the surplus last session in order to balance that budget. So we were really concerned about taking the volatile revenue, which is one of those caps that pays down our unfunded liabilities, and using that for budgeting, and that's what ended up happening. So the governor had started, I think, at about $700 million. They ended up landing around $1.3 billion in this budget, where they're taking the revenue that's volatile. It's supposed to go in to pay down our pensions, which are over $80 billion of unfunded liability. That we're most indebted in the country, and that money's been shifted over to the budget.
So you're talking about it almost doubling to what you expected. You're talking about maybe $700 million. And you're still not really for that, but then we talk about it being $1.3 million. Instead of totally preserving the guardrails, Democrats allocated new funding into Medicaid and child care. And that's where I want to talk about Medicaid. I think it's the nonpartisan Congressional Budget Office. They're saying that the big, beautiful bill and Trump's policy would cause nearly 11 million people to lose health coverage over the next decade, nearly 8 million of those due to the Medicaid provisions. It could be a little more dire here because of our population. The bill seeks to punish states like Connecticut that use Medicaid funds to cover undocumented immigrants. We've talked about this in the past, but I want to rehash this conversation here because you would reduce the federal reimbursements in that case, not you, but the federal government would do that. So how would you address Medicaid knowing what could be coming down the pike with the big, beautiful bill?
Yeah. We actually, House Republicans put forth a budget to address those issues. We no longer funded a Medicaid program for undocumented immigrants, which is costing the state over $125 million in the biennium. What we did is we shifted the money to federally qualified health centers and to dish payments for the hospitals because these individuals are going to get health care regardless but it's how you fund it. So the way the Democrats have chosen to fund it is actually going to put our Medicaid funding in jeopardy to the tune of $700 million. It was unnecessary. They could have provided those services and just done it in a better way. But I feel as if Connecticut Democrats are sort of looking to make a political statement as opposed to just complying with what the feds are looking for. Our Medicaid is really overrun right now. The able-bodied provisions that are talked about, we are spending, I think it's over $350 million in the state of Connecticut. Able-bodied people who are working, earning up to $95,000 a year are getting access to Medicaid, and the feds are paying 90% of it. That type of program is probably going to go away because it's just too rich. That area we should have taken a look at, but it was just sort of ignored. And then you have the hospital tax, which was over budgeted in the budget, and that's another area that the feds are saying you can't keep taxing healthcare and taking that money. The budget relies on that, about $375 million, which the hospitals are against.
You've always said that you're certainly not against anybody actually getting care, and that's what you're trying to talk about with trying to funnel money into FQHCCs. I'm probably saying it wrong. The federally qualified health centers and hospitals. Is that going to be enough to actually care for people, though? There's a place where you're at right now, and then we also talked to you, and I believe I talked to Stephen Harding last week, where you always say that these undocumented migrants are getting Cadillac care, and I don't know exactly if that's the case, but this is where you seem to be on the issue. Do you think it's enough to actually help these people?
Yeah, it would be. I think that population, many of them are going to hospitals and FQHCs already for their health care, but that Medicaid program that is provided is a lot more robust. So it's not even health care, it's insurance. So we're giving them, dental, eye care, prosthetics, prescription drugs. There's no copays. It's quite a rich program. There's a way to kind of scale it back, but most importantly, deliver it in a manner that complies with federal law so we don't potentially lose $700 million in funding. And to me, that's the smarter way to go.
We have a caller on the Wheelhouse. Here's Stephen from Bridgeport. I understand that you want to talk about the costs of living in Fairfield County. Go ahead. Let's see what you got, Stephen. Stephen, you there? Do we have you this morning on the Wheelhouse?
Hello.
I can't. Yeah, there you are, Stephen. How you doing?
I'm here, buddy.
All right. What do you got, Stephen?
So I got basically just two statements. Per your last, I'd like to see change in Connecticut. Number two, I'd like to see the state pay more attention to the quality of life issues within our own state. Number two, when it comes to federal money, I'm curious as to why County, being probably the fourth or fifth richest state in the nation, why we're always going after federal money. What's this? Where's all the tax dollars we're given already? Why do we have to rely so much on the feds?
Just really quickly, quickly before I lose
Please.
you here, Stephen, I just want to ask you a quick question so that I can frame this
Please.
The right way for Representative Candelora here. Is there a particular quality of life issue impacting you down in Bridgeport?
Yeah, it may seem a bit menial, but it has to, mostly it's noise. And most of them to do with two unlicensed two-stroke engines that are run all day, every day by these lawn care services, but yet they want us to buy electric cars. One two-stroke lawnmower is just as bad as a dozen cars, but yet nothing is done about this when it comes to the noise level or any of the emissions level when it comes to these crappy two-stroke engines.
And overall, you're talking about the quality of life in Fairfield County. Good to hear from you this morning
Troy.
here, Stephen. Thank you so much for calling us.
Bye.
There you go.
Yeah.
There's Stephen who's having an interesting morning there down in Bridgeport, but he does want to know, first of all, how he can solve maybe that local noise issue. But in general, I guess we're worried about quality of life issues.
Yeah, I mean, in Connecticut, we have a unique system of home rule. So the towns really govern those noise issues. We see it in Greenwich right now, where they've banned the leaf blowers during certain hours, and I think those are the things that should be taken up locally. Globally, I think the quality of life issue in Connecticut, when you look at our tax structure, we have a heavy reliance on the property tax. And I think the way we fund education really leads to housing becoming unaffordable. I spoke to this on the House floor. I never imagined that in order for me to live in my own home, I have to pay over $1,000 a month in property taxes. And when you talk to people, that largely exceeds a lot of the mortgages that they're paying. And that's something that Connecticut has to address. The state really doesn't fund education the way it should. We don't have county government. We don't have county taxes. So it really should be the state income tax that's filling in that gap. The budget did make some inroads in increasing education spending, and I think this is where the governor and us kind of depart, and we align a lot more with the Democrats, is we've got to focus on funding education at the local level more.
I want to talk about childcare, too, before we leave here today. Your colleague, Stephen Harding, said that he's worried about using the surplus money to set up the new endowment for early childhood education. I heard you say it last week, too, as well. I think I read it in the Mirror, and then I kind of threw that at Beth By when she came on the show. So just help me understand why, especially if we want state money for education, why we can't use the fiscal guardrails to help out with early ed here.
Yeah, so I think it was kind of not a smart move the way we funded it. The governor and the Democrats funded it out of surplus. By removing that money out of surplus and not allowing it to pay down our pensions, it actually took $25 million of ADEC savings a year out of the budget. Had we just put that money into the budget, we would have annualized savings of $25 million. We could have taken that $25 million and earmarked it for early childhood going forward. Instead, we took that savings and put it into an endowment that's just going to be spent down, and that money might be exhausted within 5 years. If you pay your debt down, you take the savings, now you have early childhood funded for as long as you want to prioritize it. And so that was sort of what we wanted to see. Our caucus agreed with a lot of the initiatives. I think that bill overall is hitting a lot of the issues that need to be addressed for early childhood education and getting people to be able to work and have children at the same time. It was just the way it was funded, I think, was all wrong.
This is $25 million, though. It sounds to me like a drop in the bucket. Maybe over years it's not as bad, but I say that because when we look at ECS funding and how much money you guys have for that for education overall, and I know there's more kids, but we're talking about billions of dollars. So I don't know if $25 million. I know the hard part is you have to stomach losing $25 million. But is that going to be enough at the end of the day to help on early childhood? Yeah,
it's only a small piece. Sure. We don't think it was enough, but that's what the governor's proposal called for. It was about 10% of a $200 million fund. So he was looking to fund it about $20 million a year. So we think $25 million certainly would have filled that need. But it really comes down to sort of subsidies. The private market and individuals still have to pay in what they could afford. But it is long-term, we need to do a lot more investment for early childhood.
We only got a few minutes left. If you want to give a call out to Rep. Candelora here, give us a call, 888-720-9677. Be like Stephen here from Bridgeport and give us a call, 888-720-9677. If you're a little shy, you can also email us or you can say something out on social media. I want to get your thoughts on the special session because obviously it's never written in stone that there's going to be one, but you could be working late in the summer or early in the fall. What do you might think that you might be working on? And what might your position be if you're coming there? Look at me asking you a loaded question like
Yeah, no, it's an easy one. I think we know we have to go back in to adjust the hospital tax. That number of $375 million of new taxes that were put on hospitals isn't correct. The number that they were looking for was somewhere around $285 million. It's also going to require new legislation because the governor has to negotiate a new contract. So we will definitely be in to address the hospital tax issue and then make some other fixes. There was a 5-cent tax that's put on everybody's cell phones. It's a new tax that the cell phone companies have said it's not workable the way it's structured. We can't implement it. So I imagine we're going to have to go back and try to address that as well. And then the big housing bill. It's a big question of whether the governor is going to veto it. If he does veto it, I'm sure we'll be back in to try to put forth the policies that everybody can agree on.
I thank you so much for coming in the studio this morning. It was so nice to talk to you. State Representative Vincent Candelora, we don't know if you're going to have a summer off. I know you have your own private business to attend to, but we'll see what happens, and hopefully we'll follow up with you down the road. I appreciate you coming in.
Thanks. Anytime.
That is the minority leader in the state House of Representatives, Vincent Candelora. Thank you so much for coming to the studio today. Folks, we just want you to know that coming up next, reaction to the reaction, we'll have our state government reporter, Michaela Savitt, and CT Insider reporter, Alex Punderman, to analyze the finer points of this year's legislative session. You could join the conversation, 888-720-9677, 888-720-9677. From Connecticut Public Radio, this is The Wheelhouse. I'm Frankie Graziano. A week ago, Connecticut closed the book on its 2025 legislative session. Some landmark bills were passed, and some will have to wait until next year. This hour, we're breaking down what these legislative changes mean for Connecticut residents. Joining me now, Michaela Savitt, state government reporter for Connecticut Public, all over the end of the legislative session. Thank you so much for coming on the show.
Thank you for having me, Frankie.
Great to have you on. We also have a friend with us, Alex Punderman, reporter at CT Insider. He might be batting 1,000 on the softball field with Team Hearst. How you doing today?
I am doing well, Frankie. Fresh off that big W. Good to see you.
Nice to hear from you and nice to see you. If folks have questions for our reporters, any reaction to what we just heard from lawmakers, give us a call, 888-720-9677, 888-720-9677. Alex, stick with me here. Do you have any response to what we just heard from Representative Rojas and Representative Candelora?
Yeah, I don't think there were any huge surprises. I think Democrats viewed this as a successful session. They were happy with the budget that they passed. They were glad that they were able to fund a lot of their priorities, whether it be higher education or Medicaid, special education, childcare. Not always at the levels that everyone is thrilled about, but in their view, they sort of were able to give some money where they wanted it. I know Republicans are frustrated that there was some tweaking and bending of the fiscal guardrails. I think that will remain a story every year for the near future. No huge surprises, I didn't think, from what we heard in the first two segments.
For both of you here, we talked a lot about Medicaid, and it seems like there's a discrepancy over what the actual problem is and how much funding that will be necessary. I'm looking at the undocumented immigrant angle in particular. I've had this conversation with Vin Candelora a couple of times. They seem to think that if they could, it sounded a little like I got more of a plan here today with the federally qualified centers there, and also hospitals maybe getting more money to help if we do lose funding. There's a big threat looming with the federal government potentially taking $3 billion away from Connecticut if it continues to have a plan where it serves undocumented migrants that are 15 and under. And we had somebody on the show recently from Georgetown who said that Connecticut's probably going to end up dropping them if that's the case. We don't know if the bill's going to pass, but nonetheless, folks are trying to make it harder for people to do the right thing and serve anybody that needs medical care. So I don't know if any of you can kind of dissect that or at least help us understand if Vinnie Candelora has it or doesn't have it in terms of having maybe some money for undocumented migrants if coverage is dropped?
Well, I can speak to the, what Democrats in the majority are thinking. I think this session, the goal was about holding the line on Medicaid funding or the state-funded healthcare for undocumented immigrants. I spoke with House Chair of the Human Services Committee during the last days of session. That's Rep. Jillian Gilchrist. And, I think, our discussion was around, is there, what about the calls for expanding Husky for immigrants? And she was, pretty confident that, the fight is going to be challenging to expand what we have right now, given what's happening on the federal level. But I know that, her and, many other Democrats are going to be looking to continue that state investment in healthcare because, what the numbers show us is if you provide that healthcare coverage to people, it prevents bigger costs down the line from major, health things coming up in hospitals and at the doctor's office, et cetera.
That's a great point, Michaela. Essentially, the summation here is that Republicans think it's too rich to provide health care to undocumented migrants. They talk about a Cadillac plan. Other folks will bring up the fact that, first of all, you have to provide coverage, and second of all, there's really a downstream effect if you don't treat them. When Michaela does come on the show, we like to talk about the environment, so I want to dig into some bills that passed, particularly bills addressing the climate crisis. I understand 2 big bills made it across the finish line. What do those bills do?
So, apologies there. I was just my alarm was telling me to
God
wake up.
Calling. I think that's God calling. It's saying, hey, I had my alarm go. I've got a new phone. I've got my alarm going for like an hour now. I got to turn it up. The alarm was too low.
Well, the alarm
so I
was
got to tell iPhone, chill. You got to turn it up.
It was saying it's time to talk about climate change.
It's time to talk about climate change. When is it not time to talk about climate change? Go.
Well, in my perspective, it's always the time to talk about our environment and climate. Sometimes I think this issue gets pushed around to the side because other things are happening, but in our
like
world,
a future thing. Look at
a
it
future
as a future
thing.
Yeah.
And so I do want to talk about the 2 of this pair of bills that passed, and they both made it across the finish line, which advocates were very excited about. First was the mitigation bill, which I know I've talked about before, and this got passage on the last day of session. That focuses on, bringing down our human-driven greenhouse gas emissions. So it updates the Global Warming Solutions Act. So it says, hey, the state needs to reach net zero emissions by 2050. A lot of other parts of the bill, it's a big bill, as many of them are based around reports or plans or studies. Another part is, the PURA has to report on a solar canopy strategy. Other parts call on our Department of Environment, Energy and Environmental Protection to develop plans for heat pump systems, evaluate how to involve nature-based solutions in mitigating our emissions, and renters' use of energy efficiency and clean energy programs. Now, looking to the other bill, which is more about how can we prepare our state to handle future impacts of climate change. Again, incremental kind of thing. Yes, exactly. Resiliency. And this one had a lot more bipartisan support, I think, because it focuses more on the side of, it brings into it brings the economy into play. It brings like the real life impacts into play as opposed to some of those more big costs and investments, which we'll talk about a little bit later, I imagine. So included in that is like, hey, we're going to create resiliency districts. This will help towns finance mitigation projects. It requires updates to the state's hazard mitigation plans, updates the state's water plan. And it also requires information about flood risks to residents. And it requires sea level rise when it comes to new building. And, so these 2 bills really came in tandem with one another. And advocates said, this is good. We're very happy. It's been a couple years since major legislation surrounding climate has passed. There have been things, in bonding and other smaller bills. So these were compromises that were made, and as one advocate said, I think there would have been like an uprising if no major climate policy had passed this year.
So I'm not wearing a hat, so I can't come to you with my hat in my hand, but I guess I come to you with my heart in my hand here to ask you, because I'm not necessarily understanding it as well in terms of the nuance. So does this represent real money or real investment? Is this a situation where I guess is it a political will issue? Is there political will to get this done? Or is this more of kicking the can down the road? And I guess finally, how much of it is some kind of effort to address climate change, but not being able to do so on a bigger scale like we couldn't with the California emission standards and trying to do that in Connecticut by 2035? So I guess I'm trying to say in some drawn out way, because I'm trying to understand it, is there real political will behind climate change efforts? You talked about pushing it sort of to the side. Is this a real kind of change in these two bills, or climate activists worried about it?
Well, I think there is definitely political will, and I think climate can become a very political issue as well, and it can become a very partisan issue. So a lot of compromise has to be made on that front, and that was something that was very apparent this year. That they were working in a lot of ways. Both sides were working really well together, and I think that when you talk about the political will, I mean, are you saying like?
No, you answered it the right way I wanted to understand. I'm just trying to figure it out from my perspective. I wanted to see if this was kind of a good thing or a bad thing. It's not necessarily a bad thing, but when you're talking about climate change, you're talking about having some kind of meaningful change instead of kicking the can down the road. And when you talk about this being a compromise, it helps me understand that the bill can be seen by people that care about the environment as a good thing because compromises were made. So it seems like you did help me get to the nuance there.
Yeah.
I appreciate it. Alex, let's pivot to Connecticut's affordable housing crisis, which continues to be a big talking point every year at the state capitol. Did any major housing bills pass through the session this year?
Sure did. Probably the most significant housing legislation in years. It could take a whole other hour to explain everything that's in the bill, but the sort of thrust of it is encouraging in different ways, not requiring, but encouraging towns to zone for more affordable housing. That bill is kind of in limbo right now as we wait to see what the governor is going to do. It seems like instead of signing it or vetoing it and having that be the end of the story, there's going to be some sort of compromise. There are certain provisions in the bill that the governor does not like, and it's starting to sound like there are going to be some maneuvers to eliminate those provisions. But as written, I think this bill, it's pretty similar to what Michaela was just saying about about climate. This bill would not be every last thing that housing advocates wanted. It was certainly, there were a lot of compromises along the way to get here, but it's been a while since Connecticut had anything of this scale, and it'll be interesting to see what happens next with it.
I lobbed sort of a flimsy softball at Michaela a second ago with the question that I asked, so let me do the same to you here. Help me understand, in terms of this legislation, is this going to look more like work, live, ride after they're done with it? I guess so. Are we going back to more transit-oriented development versus making some more meaningful change on, I guess, affordable housing? Or do we know anything yet before the session?
That's a good question. Work, live, ride, which is the transit-oriented development concept, is in the bill. There are sort of a bunch of different provisions. There's also a provision that the governor introduced that would basically tell towns you can designate these specific development zones and be a little bit more permissive about what gets constructed in those zones. And in exchange, we'll kind of go easy on you when it comes to some of the other regulations. That was kind of a controversial proposal because it was both encouraging towns to build more housing, but also easing up on the regulation around affordable housing in other ways. This sort of central component that people have maybe heard about where towns are given an allotment. There was a study that calculated, it sort of divided up the housing need across every town in Connecticut. lawmakers then divided that by 4 to make it a little bit easier and then gave each town an allotment. That is the part that the governor does not like and that a lot of Republicans also don't like, and some Democrats. In Fairfield County in particular, this has been very controversial. It's not that towns would have to build or necessarily even zone for those units, but if they did so, they would be prioritized for some state funding.
Work, live, ride, transit-oriented development, Michaela, does have something to do with climate change initiatives. Can you help us understand that?
Yeah. Like Alex was talking about, it would encourage municipalities to build more housing near public transit, like buses, trains. And I think the bottom line is to encourage less of a reliance on cars, which in turn, contribute many of them, contribute to our greenhouse gas emissions, which is making our climate warm up even faster. And transportation is the biggest contributor in Connecticut to greenhouse gas emissions. And I think the zoning changes are also intended to help, talking about using our land in better ways, like converting industrial or commercial buildings into housing rather than building new everywhere. And there was also, in talking about planning and development, there was also a new plan of conservation and development that was passed this session, and climate was baked into that in a major way as well. So a lot of climate-oriented thinking in legislation. I
got to ask you guys about something that might also have some climate initiative kind of things in there as well, or at least it involves the the environment and conservation efforts. I just got to ask Alex quickly: are you hearing anything about the hospital tax coming up in the special session? Is this something Republicans will push, but Democrats don't really want to talk about? Is there an issue with this hospital tax? What do you think? Are you hearing anything about it?
Yeah, that is not my area of expertise,
yes.
But I think we're still kind of waiting. Maybe Michaela has a better answer. I know we're still kind of waiting to see what's going to happen with the special session.
And I haven't heard as much on it. I just wanted to see if you did. So we're on the same page there. Hey, let's go here quickly. I think Alex could start us off here because I wanted to ask you about black bear season, growing cries for bear hunts recently. There's a connection with Deep. Michaela, I can have you explore, but do you think we'll hear anything about bears in the special session? Do you think this is something that can come up next year?
It's definitely going to keep coming up as long as people keep having bears in their backyards and sometimes in their houses. It's going to continue coming up. The idea of a bear hunt is very polarizing. Strong opinions all around on that. It looked on the last day of the session like there might be at least a study to look into different remedies. People talk about, bear awareness and trash cans that are harder for bears to get into, which would maybe be something to try before we start shooting the bears, depending who you ask. There's definitely going to continue to be ideas bounced around on that.
Alex Putterman's bear aware. I want to know if Michaela Savitt. So we have the Deep connection with Katie Dykes. It sounds like she's at least endorsed the idea of a limited hunting season like Massachusetts and New York. So do you think that goes anywhere? Do you think that she has the ability to kind of effectuate change there? What are you and Patrick Scahill, who's our digital editor here? What are you guys hearing about a possible bear hunt in the future?
Well, Deep does not have the authority to allow a bear hunt. The final version of the bill, there was a lot of changes in the last couple of weeks, but the final version would have, like Alex said, allowed a study, and a small part of the bill would have said, hey, and, if we were to do a bear hunt for the purposes of public safety, what would that look like? A previous version would have allowed the governor to declare, or would have allowed the governor to direct Deep to make rules for a bear hunt, I believe. Something along those lines.
Thank you for clearing that up. I appreciate it. So that maybe some encouragement from Katie Dykes. You've been listening to Alex Putterman, reporter for CT Insider. Alex, thank you so much for joining us today.
Thanks for having me, as always.
So good to see you. You've also been listening to Michaela Savitt, state government reporter for Connecticut Public. Michaela, so great to have you on.
Thank you.
Thank you for coming by in studio. Today's show, produced by Chloe Wynn. It was edited by Patrick Scahill. Our technical producer is Gene Amatruda. We also had help today from Robin Doyen-Aiken and Meg Fitzgerald. Download The Wheelhouse anytime on your favorite podcast app. Thank you to our visuals team at Connecticut Public and our ops team. I'm Frankie Graziano. This is The Wheelhouse. Thank you for listening.